All right, so let's work on this problem. The patient client is to receive compazine or prochlorperazine, 10 milligrams intramuscular every 4 hours as needed for nausea and vomiting. The medication is available as compazine or prochlorperazine, 5 milligrams per milliliter. How many milliliters should the nurse administer? So this is a pretty straightforward question. And this is a question that I would say is similar to your reconstitution questions. You're going to take your, I always start with the order. So so the order is 10 milligrams. We have available 5 milligrams per milliliter. So my answer for this question would be to administer 2 milliliters of that medication. Okay. And let's see what we got here. Next question. All right, so, oh, okay, this is gonna be interesting. So a patient client consumed 2 ounces of coffee, 2/3 ounce of ice cream, and 1 ounce of beef broth. What is the total number of milliliters consumed that should be documented for the patient client? So we're gonna have to convert ounces to milliliters. And then I was just looking to see, so I could see that the person who took this answered 109, but the correct answer is 110. So let's see if we can find out why that answer is that. So first thing is you need to know that 1 ounce equals 30 milliliters. So that's an important piece of information to know. So let me just write out the 2 ounces, 2/3 ounces ice cream, and then 1 ounce of broth. So 1 ounce, I guess I could just write that down here, is equivalent to 30 milliliters. Okay. So what we need to do is, sorry, let's see if we can get that to focus again. There we go. So if this is 30 milliliters, this is 60 milliliters. So the 2/3 ounce is going to be interesting. So the way I would set this up is I would actually set it up as 2/3, okay, times. So I'm going to make a conversion. So this is still ounces at the top, 1 ounce, 30 milliliters. And then when I do that, I'm going to have 2 times 30, which is 60, divided by 3. And that's also going to give me, and that's going to give me 20 milliliters. And then I'm going to add these up. So 20 plus 30 plus 60 will give me 110 milliliters. So sometimes if you put 2/3 into a decimal, so that's 2 divided by 3, you'll get 0.6666666, very similar to what we had before. If you multiply that by then 30, you're still gonna get 20 as long as you leave that in your calculator as it is. But sometimes if you, let's just say you just did 0.7 times 30, you might get 21. If you do 0.66 times 30, you're gonna get 19.8. So that could also be why you can get a different answer than what's here. So or then, if you got 109 milliliters, I'd have to see the math to see how they got to that. But this is how you would set that up. 2/3 times 30/1 would give you the 20 milliliters for this question. Okay. Let's see what else we got here. I should also tell you, this is my first time looking at these questions. So if I struggle through it, I'm just showing you my process in its raw form, I guess. All right. So the physician prescribed 7.5 milligrams of a medication that is available in 5 milligram tablets. How many tablets would the nurse administer? So in nursing, you may know that you can tablets are typically scored, or at least they can be scored, which means you can give a half tablet. And so for this one, the order is 7.5, and we have 5 available. So we have a 7.5 milligram order. Each tablet is 5 milligrams. So 7.5 divided by 5 should be 1.5. 7.5 divided by 5 is 1.5. So 1.5 tab. Sometimes they want you to write it like this, 1.5 tabs. It just, or tablets. It just depends on your instructor or how they're grading that. And if it's a multiple choice test, then obviously you choose the one that's most applicable. All right, let's look at the next thing here. Let's see. All right. This is a weight-based question. So we have a child that's weighing 18 kilograms, ordered Zithromax 10 milligrams per kilogram. The recommended dose is 10 milligrams per kilogram per day. So it looks like if it's 10 milligrams per kilogram is the order and 10 milligrams per kilogram per day is the recommended dose, then it looks like it's within a safe range. The oral suspension is dispensed as 200 milligrams in 5 ml. How many milliliters should the nurse administer? So I mentioned first, is this safe? Because let's say the recommended dose was 5 milligrams per kilogram and the order is 10, then you would need to consult with the physician because this would not be a safe dose to administer, but it's within the safe range. And then this is just extra information. So what we need to do is, this is actually a 2-step problem. Step 1 is we need to account for the patient's weight to get to the kilograms by itself, or the milligrams by itself, and then compare it to the suspension, the 200 milligrams in 5 milliliters. So let's do that real quick. So we have patient weighs 18 kilograms, and we're going to multiply that by the 10 milligrams per kilogram. We cross out kilograms, and we get 180 milligrams as our order. Then, since we have the 180 milligrams, now we can go ahead and convert milligrams to milliliters. We don't want milligrams. We do want milliliters, 200 milligrams, and then 5 milliliters. So I'm going to take my calculator. I'm going to take the 180 times 5, gives me 900 divided by 200. And I'm going to get 4.5 milliliters. It's a good question. All right, let's go back to quiz. Let's see what the next one is. All right, it says to administer 250 milliliters of medicated IV fluids over 30 minutes using an IV pump. What is the rate? So this one's not meant to be difficult, but a lot of times, believe it or not, this is a commonly missed problem. The reason it's commonly missed is because you're being asked to put this into milliliters per hours, but it's in milliliters per minute. So there's 2 ways to do this. Okay, so I'm going to do this on the page here. The first way is the easy way, is just to say, okay, well, if they're going to get 250 milliliters in 30 minutes, in an hour, they'll get 500 milliliters. You can see that the answer down here is 500. Alternatively, if you ever get stuck, and let's say this number was bigger than 60 minutes, like 90 minutes, or if it was 45 minutes and you can't do that quick conversion in your head, what you're going to do is you're going to take the patient, or you're going to take the flow, which is 250 milliliters over 30 minutes, and you're just going to convert minutes to hours using dimensional analysis, of course, because I'm the dimensional analysis guy. Okay, so we're going to convert minutes. So we know, or just going to put the minutes here and an hour down here. So in 1 hour, how many minutes? 60. Supposed to be the word minute. Okay. And then we're still going to get that same answer, 500, when we do our calculation here. So 500 mil per hour. So if you ever get stuck, just remember that you can always convert to minutes if you, or hours to minutes, minutes to hours if you need to, and vice versa. If you have a flow rate or a drop rate question, you might need to convert hours to minutes, and then you'll calculate that. And we'll see if we get an example of that. Okay. All right. Next question. And then this looks like a drop rate question. So this is a good one. Okay. So it says the patient is to receive 1,000 milliliters of normal saline over a 10-hour period of time. Use a macro drip of 15 drops per milliliter and determine the drops per minute. Okay. So I'm going to write down the important pieces of information here. We have 1,000 milliliters. We have 10 hours. And we have 15 drops per milliliter. All right. So when I do this question, I always like to make sure like we are setting or kind of setting up the problem before we do anything. So first and foremost, anytime you have a drop rate question, there's a basic formula or flow that goes like this. You have your flow rate times your drop factor, and that equals your drop rate. Okay, so flow rate times drop factor. My flow rate in this question is 1,000 milliliters per 10 hours, and then 15 drops per milliliter. So I'm going to show you two different ways to set this up. Now, and I'm going to show you this first way is I think the more straightforward way. 1,000 and 10 look like they'll go into each other easily. So the way, what I'm going to do is I'm going to make 1,000 milliliters over 10 hours. And then I'm going to go ahead and just reduce that down. Okay. So 1,000 over 10 is just 100 over 1, right? So we'll just confirm that. So 1,000 divided by 10 would be 100 milliliters over 1 hour. See how I simplified that question just by reducing my flow rate to milliliters per hour? And the drop factor, this question is asking for drop factor in drops per minute. Okay. So I'm going to do another conversion. 1 hour is what? 60 minutes, right? So 100 milliliters, 60 minutes. Now I'm going to multiply by my drop factor. Okay. And then I'm going to take 100 times 15 and then divide that by 60. And I'm going to get 25 drops per minute. Alternatively, you could have converted hours here to minutes. So 10 hours is the same thing as 600 minutes. And then you would have did 1,000 milliliters over 600 minutes times the drop factor, and you would have still gotten 25 drops per minute. Either way you did that, you would have gotten to the same answer. All right, let's look at the next thing here. Okay, the physician ordered 100 milligrams of Cleocin or clindamycin intramuscular every 6 hours. The drug available in a vial labeled 300 milligrams per 2 milliliter using a 1 milliliter syringe, rounding off to the nearest 10th. So it tells you where to round. How much Cleocin would the nurse give for each dose? Okay, so 100 milligrams, drugs in a 300 milligram per 2 milliliter syringe. And you're going to use a 1 milliliter syringe and round to the nearest 10th. In all reality, using for math purposes, it really doesn't matter what syringe you're using. You just need to know if you can get to the nearest 10th with that. And obviously in a 1 milliliter syringe, it'll be, you'll be able to do that. So all we're going to do is we're going to take our order, the 100 milligrams, divide it by 300 and times it by 2, and then see what we get. So let's do that real quick. am going through paper here. That's great. Okay. All right, so my order was 100 milligrams, and then my available was the 300 milligrams per 2 ml. Okay, because that's what it told me. So this is my order. This is my available. Using dimensional analysis, I start with my order of 100 milligrams. I have milligrams, milliliters, because I'm looking for milliliters. So that also is what tells you where things go with this. So now I'm just going to take my 2 times 100, which is 200 divided by 300. So 200 divided by 300. I know we're going to get this 0.666667. So you're going to round this because it tells you that it's to the 10th. Okay, so we have this 6 repeating. You're going to round that to 0.7 milliliters. You're going to round it to the nearest 10th. And then let's just confirm and see if that's the right answer according to this quiz. So yeah, the correct answer is 0.7. The student who answered the 0.6 most likely didn't think to round up the answer, which is common. That happens. So don't, if you're making that answer, just know that, you know, the correct answer would be the 0.7. Oh, okay. And this is asking you, I guess it's the first question was, what is the unit? It would be milliliters. And then, okay, anyways. All right, next question. Physician prescribed 5,000 units of a medication that is available in 10,000 units per milliliter. How many milliliters would the nurse administer? So this one's a little bit more straightforward than even the previous one. You have 5,000 units ordered, 10,000 units per milliliter. So you can even do this in your head and realize the answer is going to be 0.5 as it's here. But if you're setting this up or you need to show your work, let me just show you what that looks like. So again, I always start with the order, which was the 5,000 units. And then I multiply it by my conversion, which is the units per milliliter. I put units on the bottom so I can cancel them out. 10,000, 1, and I get 0.5 milliliters when I plug that into my calculator. And then we can see here, correct answer is 0.5. Okay. All right. Well, I hope that was helpful looking through some of those. And we'll pick up some questions here another time. All right. Take care.